September is National Recovery Month. It shines a light on the millions of Americans in recovery from substance abuse or mental health challenges. Dr. Erin Wilson is the Chief Medical Officer at the Meadows. It is a treatment center in Scottsdale. Doctor, thank you so much for being with us today.
Yeah, thanks for having me.
How is the stigma when it comes to addiction, when it comes to mental health?
You know, we've seen there's definitely a decrease in the stigma. I think there's been a lot of movement away from that. You know, specifically in the addiction space, that's kind of the lagging piece to it. I think there's the most stigma attached to that. In fact, shame and guilt really fuels addiction, so we're still seeing a lot of it. You know, at the Meadows, we're really trying to fight that by just, breaking down those walls when people come in and just open them, welcome them with open arms to the program.
Now, what do they say? Addiction is a disease.
Yeah. Yeah, as we've moved into the disease model, understanding it's not a moral failure, I think that was the old narrative. You know, I think now that we understand the neurobiology of addiction and trauma, I think we've made huge strides to kind of get away from that.
What are some of the signs that we may be addicted or one of our loved ones may be?
You know, I think for loved ones, it would be a big change in behavior. You know, I would say change in mood, like mood irritability, depression, anxiety. The big indicator that I tell a lot of people about is withdrawing from social support. So if they stop showing up to family events or start missing work, those types of things. You know, within yourself, it's not being able to cut back, kind of that compulsive drive to use, even though things around you are starting to fall apart.
What does the word recovery mean? What does that look like?
Yeah, so recovery means to, basically to get away from the substance in a healthy way. You don't want to, of course, replace it with some other, addictive process, but really getting into a recovery community is to be away from substances, work a program, using social supports. There's lots of meetings and community that drives that.
We hear about the Meadows because of the facility in Wickenburg, where famous people go, and we report it occasionally. You have the outpatient facility in Scottsdale.
We do.
What are treatments like there?
So the outpatient program is a great way. Some people start at that level of care. It's an intensive outpatient program, so it's either like 3 days a week or a 5-day-a-week program. It's for people that may not, need that higher level of care to be in a residential treatment center. The other great way to use a program like that is maybe to start with Wickenburg, do a more intensive program, and then step down and transition into that lower level of care.
That outpatient, are you holding a job down during that time?
A lot of people do, and we've built a lot of the programming to allow people to be able to do that. So we have a lot of professionals, executives, people that have jobs. We have a lot of parents that have to work around their kids' schedules. So it really allows them to still work a program, be in recovery, but also still live their lives.
What do you wish more people understood about mental health and addiction?
You know, I think, as you mentioned, the stigma, kind of breaking that down, understanding that it is a disease process, that was a huge part of my development as a psychiatrist, and really that allows us to connect with patients and allows them to understand it better. I think understanding that there is no, when you come to a treatment center, we're going to really roll out the red carpet for you. A lot of people are afraid of the detox or withdrawal side of it, and there's a lot of huge developments that allow us to really do that safely and effectively, where you're not miserable. I think that's really important for people to understand.
What kind of resources should we be turning to?
I think understanding that, there's a lot of different treatment options out there. You can do community resources. There's programs like the Meadows, reaching out to friends and family that can help us find those resources. Just really quickly, the president of the Meadows actually just wrote a book that was released this month called The Rehab Playbook, which is really helpful because it's hard to understand that space if you've never been through it. And it kind of walks you through the process and really what to look for and how to navigate it.
And I bet family members want to read it. They want to know, too, what's going on with them.
Yeah, it's really, really helpful for people.
Doctor, thank you so much for coming.
Yeah, thanks for